We will now discuss about coronary artery disease. The heart is a muscular organ that pumps blood to the body. Oxygen and nutrients are required by the heart so it can keep pumping, and this fuel is carried to the heart muscle by the blood that flows through the coronary arteries. So the coronary arteries serve as fuel pipelines to the heart muscle. Coronary artery disease occurs when the arteries supplying the heart become narrow and blocked. Atherosclerosis is by far the commonest cause of blockages in our arteries. When atherosclerosis affects the coronary arteries, it is referred to as coronary artery disease or CAD. The estimated prevalence of coronary artery disease in India is around 3 to 4% in rural areas and 8 to 10% in urban areas among adults older than 20 years, representing a twofold increase in rural areas and a sixfold increase in urban areas over the last 4 decades. About 30 million people were estimated to have coronary artery disease in India in the year 2003. The inner lining of the normal coronary artery is smooth and free of any blockages or obstructions. As we get older, fatty substances are deposited as fatty streaks. The streaks are only minimally raised and thus do not produce any obstruction or symptoms. Fatty streaks can start to develop in early childhood, so maintaining healthy lifestyle habits is important from a very early age. Patients with one or more risk factors for CAD are susceptible to the increased buildup of fatty substances called the atheroma. And what are the risk factors for developing CAD? They include high LDL cholesterol, high blood pressure, diabetes, cigarette smoking, obesity, poor dietary habits, lack of exercise, strong family history of CAD, stress and strain. When the channel diameter is reduced by more than 50%, the artery may become obstructed enough to impact blood flow to the heart muscle during exercise, emotional stress, etc. The imbalance between the supply and the demand of oxygen can cause chest discomfort. This is known as angina or angina pectoris. In other cases, the plaques within the inner lining of the coronary artery may develop a slight crack or rupture. Plaque rupture is recognized as an injury by the body, which then produces a blood clot at the site of rupture in an attempt to seal off the superficial crack. The sudden increase in the obstruction caused by the blood clot can transform a mild blockage into a critical one within a matter of minutes. The decrease in blood flow to the heart muscle may be severely reduced, and the patient will experience severe and prolonged chest pain that occurs at rest and may even awaken them from a sound sleep. This is known as the unstable angina or acute coronary syndromes. However, the clot may continue to grow. This can completely fill the open channel of the artery and cut off the blood flow to the heart completely. Without oxygen and nutrients, the heart muscle is damaged and the patient suffers a heart attack. It is also called the myocardial infarction. The good news is that there are several forms of treatment that can get rid of the blood clot and restore flow across the artery. The bad news is that all these treatments are time sensitive and can only be employed if the patient is rushed to the emergency room of the nearest hospital. Every minute counts when it comes to salvaging heart muscle.